What if the future of healthcare wasn't decades away, but already here? From AI-driven diagnostics that detect disease earlier than ever to predictive analytics that help save lives, artificial intelligence is rapidly transforming how medicine is practiced. Welcome to the AI Certs Healthcare Podcast, where we'll explore the cutting edge of this transformation. My name is Gordon Pellos, Executive Vice President of Partnerships and Enterprise Strategy at AI Certs. It's my honor to introduce today's guest, Dr. Susanna Bowling, a distinguished neurologist specializing in vascular and neurocritical care. She brings decades of experience in hospitals, the broader healthcare industry, and advanced medical practices. Her leadership has driven significant growth and quality improvements, and as a certified executive leadership coach, she's passionate about helping individuals reach their highest potential. Guiding our discussion today is Rob Nail, futurist, former CEO and associate founder of Singularity University. With a background in automation equipment, robotics for cancer research, and drug discovery, Rob offers a rare entrepreneurial and global perspective on how exponential technologies can solve some of humanity's toughest challenges. Together, we'll explore how AI is reshaping healthcare, from frontline patient care to the strategic decisions driving institutional change, while tackling the biggest challenges providers face today. They'll also share how healthcare professionals and organizations can embrace AI to develop the skills to be part of the solution for the future. Whether you're in healthcare, technology, or simply fascinated by the future of medicine, this conversation will leave you informed and inspired.
So much, Gordon. Well, AI is obviously the topic of the day, and I'm so excited to be here and to dig into probably the most important area that AI is being applied is within our healthcare system. So, Dr. Bowling, really a pleasure to get a chance to dig in with you today. Maybe you can just start with a little bit more on your background and your work today.
Well, first, thank you for inviting me to this conversation. It's something that is very dear to my heart, as it should be for most healthcare providers nowadays. I got introduced to the first concept of AI several years ago, and I am a stroke physician. And AI evaluation of acute stroke imaging is something that is not new. It's been worked on for over 10 to 15 years, to the point that some of the key research done on how to manage patients with acute strokes, in particularly the delay windows, required evaluations with imaging that was processed through AI-trained imaging tools. So that's where that was my first introduction to AI. And as a matter of fact, as soon as we could afford to buy these tools, we introduced them into our hospital system. And it's been now over 7 years that we have been evaluating every single patient that comes with acute stroke, utilizing AI imaging perfusion data to determine the management of these patients. So that was just a start, right? And at that time, AI was still very futuristic for those who are not involved in AI in a day-to-day basis, because the truth of the matter, the more you know about AI, the more you realize that healthcare is way behind on implementation and adaptation of AI when comparing with other industries. But now particularly since the development of very good, ChatGPT and all these, systems utilizing language that have made AI more feasible in utilizing for the average individual, that we're seeing AI kind of invading every field, and for sure the field of healthcare. So that's been a focus for the last, for sure, 2 to 3 years since ChatGPT particularly came into the field. And my particular interest came also from the fact that my institution is being now purchased by a company that is all about automation processes, AI, and development of a very futuristic vision of catalyzing healthcare to make a better healthcare than what we have today. So that definitely has inspired me to get heavily involved into educating myself, knowing more about AI and how to become part of the machine that builds it and moves it for our future.
Can you share a little bit more about how you've gone about educating yourself and where you've gone and what you've learned?
Well, that's pretty much an example of where AI is in the world, which is that what do you do to get educated? is you cannot just buy a book and say this is how you start and this is how you follow and this is how you grow. So that's the first thing I had to say, is that there has been such a lack of process of how to utilize the little time you have as a physician, but I believe in any field, the little time you have as a professional to really master a subject that you need to become a master on in a very short time. So I went on to look in the online what offers existed for education, and obviously you aim for names and you go on to pay a very large amount of money to spend some time educating yourself. I particularly went to MIT and looked for the training courses that they have, and I selected one on AI in healthcare. And that was my first introduction to AI. So obviously, as a first introduction, obviously there was a lot I needed to learn, and I learned. Ever since then, I have identified other processes of education, and not only just in reading. Obviously the web has tons of information, but as far as the structured education, that's why I am here talking to you today, because I found AI search to be just a phenomenal way to have an organized project management of my education on artificial intelligence and the future.
That's great. And obviously the pace of this technology, AI and its applications is also changing so fast that it's really hard to know where to go. I'm curious, how does that relate to your organization or your peers? Like, how does everyone else figure out where to go?
Well, first of all, I think that the number one problem is that individuals in the world of healthcare are not yet aware of the fact that AI is a reality. So there's a significant deficit of knowledge. And part of it is because people don't think of AI yet as something that is crucial for their own growth and development and for their own safety of their positions that they carry. So what I'm seeing very quickly in the last year is that institutions like, for example, the American Academy of Neurology, which is the institution very dear to my heart, where the leaders are very heavily interested in AI development, AI research, AI education, has started even this year in the international meeting to just have a significant offering of programs around AI education, something that you did not see the year before or even 2 years away. So it's been very quickly that it went from nothing to a lot. You see in almost every field in healthcare now has emails or has journals in which AI is being part of the conversation. And that's been a transition that's been very quickly. So at the institutional level, you have to start even educating individuals about how to utilize the computer system in occasions. So now we have to try to educate individuals into how to understand AI. But how do you educate? How do you tailor the education to the different stages of training or positions into our healthcare ecosystem? What do you teach the individual who is in the MAs that are in the clinic, and how do you teach the administrators of the hospital system? How do you teach the physicians? How do you teach the patients? So they are the number ones that need to get comfortable with the use of AI in order for AI to be successful in healthcare. So how do you facilitate and lure patients to get involved is also in their own education? There's a huge question that is not being addressed yet, but as part of that quick transition from 0 to 1,000 that you need, that is starting to be that conversation.
That's amazing. And I think we'll definitely want to dig deeply into this concept of educating on a holistic basis, right? The ecosystem, the patients, not just the doctors have to know about this. So before, you kind of described the environment being one where everyone has to take the responsibility upon themselves at this moment, which creates a huge opportunity for better vision for institutions and organizations to align with partners and really help educate that entire ecosystem.
Well, I truly believe, if I might say, that the success of any institution in healthcare nowadays is going to depend on their success of implementation of AI. And as part of a change management, you have to include the concept of how to educate those that you're going to try to change and lure into adaptation to AI in order to be successful. I believe without education, there won't be success.
Amazing. And I can already say that I am excited, and I'm sure your organization is excited to see you becoming one of those leaders to help chart the path for AI.
Yeah, well, I do what I can.
We're back for part 2 of our AI in healthcare conversation. We're now talking about the future of AI in healthcare with Dr. Susanna Bowling, distinguished neurologist, and Rob Nail, futurist, serial entrepreneur, and former CEO and associate founder of Singularity University. Let's talk more about the future applications of AI in healthcare. I don't know about you, but I'm excited by the promise AI holds for so many areas of healthcare, from drug research to more efficient operations, triage of patients, and robots assisting humans perform surgeries. My mind is swirling with the endless opportunities.
So, Dr. Bowling, you had described getting involved with AI in your organization more than 10 years ago with AI imaging and systems. And obviously, in the last couple of years, there's so much excitement and a lot of hype around AI in every space. What's the reality today? Where do you see and how do you see AI empowering and improving healthcare today?
Well, the reality right now, I believe, is if you were to think of a group of atoms fighting with each other, going all over the place, that's where I think AI is nowadays. So it's become suddenly a reality. We need to get all aligned, and how do you do that? So because there is not a a roadmap of how to involve yourself into AI. We talk about education of yourself, but how do you implement AI in an entire ecosystem of a healthcare system? So because of that, there is a mixture of excitement because you see the future as a great thing, fear because you don't, this is something that you want to do right from the get-go, but you don't have a guide on how to do it. And then at the same time, um, excess of options are there that makes you not understand what you need to really put your attention into. What are the thousand opportunities you have in front of you is the one you really want to invest. So the current reality is that everybody's interested in AI. No one really knows how to do it. Everybody has ideas, but there is that limitation by the inability to have a roadmap of how to implement it. So what you end up having is like silos of built up of you have money to create something, you build up here. If you have an idea and people that believes in you, you build up something else. But there is no a cohesive, well organized roadmap of ideas of how to grow, how to build, how to evolve, and that's really what I'm excited about, because my system is right now really going through that beautiful transformation, trying to create that roadmap for ourselves, but something that is where there's over 500 people involved in the thinking process of how to do it, which is really extraordinary. Mm-hmm.
That's great. So that's some of the promise to come. And before you talked about already using AI for imaging, diagnostics, some early stage examples there that, organizations and clinics are already seeing value. We were talking previously about a couple of just very recent headlines around, clinics seeing 40% fewer calls with needing human intervention because of AI patient communication systems being implemented, automated scheduling systems reducing and saving tremendous amount of times at the clinics. Gordon had mentioned an article recently that he saw where the survey suggested 44% of the surveyed people between ages 18 and 35 believe that using ChatGPT was just as good as talking to their doctor, which I feel like that's a very loaded statistic, but it shows a little bit of the promise for patient experiences, reducing the amount of just administrative work that doctors have to deal with. How do you think about the potential promise now of AI and what it'll bring to your organization?
Well, so when we think about AI in healthcare, we need to think about the different components of healthcare. So, as a patient, so what is the promise of the future? If anything, is empowerment, is the ability to own your health. Right now, a patient wants to make an appointment. It's a nightmare to get an appointment in process, in timing, in not knowledge. The cost of care is huge. The lack of understanding of your own care, the lack of cohesiveness between when you move from one physician to the other. No one seems to know what's going on because the conversation, the communication is so fragmented. So a patient has the chance now to own their health and also to own the process of their health. And that alone, combined with potentially understanding the cause or maybe having a way to control the cause, that's something that I think AI is going to be able to give the patients. For the provider, you mentioned some of the things in regards to the process of doing scheduling, answering patients' calls, and having an AI automatic process that can filter the calls that are truly needed for a human to get involved versus those who can be addressed with automation and agency from the agents that can do that automatically. So that could save tremendous amount of time. Today, the average physician, or we would say the average provider, spends more than 60% of their time in not clinical actions. That means that it's all clerical. If you remove that clerical portion and you really expand the clinical time to 100%, by doing so, not only you are improving the quality of life physician, because we don't like writing notes, we like seeing patients, right? So the burnout is decreased. We don't do minutia, we do things that make a difference. But also imagine the difference of that on the access to care, which is another thing that will help patients. Patients want to get to the physicians, they'll have access to care. The physicians will be less burned out. The care will be to do, and you also have access to tools that allows you to augment your intelligence. Then you will be able even to research on your difficult cases to ensure you are not missing things to do to the patient. It gives you also the security that you have a quick way to remembering things that you may not know and get up to date, the most up to date treatments or options that you may have. So all that is at the physician level. At the administrative level, the idea is a more efficient care. More efficient care equals less cost. Less cost means better bottom lines and margins, where you can use that margin to reinvest in the systems to continue to grow and get better. So from the administrative side, it's huge. And from the payer side, also is the same thing. Having an AI program that allows you to understand when the physician orders an image, for example, that the AI automatically understands that image doesn't need to be preserved it can be automatically preserved. That saves in individuals, but also imagine the quality for a patient who testing can be done quicker. So at all levels, from the patient, from physicians, administration, payers, everybody is going to get benefit. And we can even talk about research, how much research can improve with the utilization of AI, making research faster and less costly. And that's huge when developing any new drugs, which are already very, very expensive, but you can cut down on the cost of the evolution of the drug. You can also cut down on the cost of the drug, and that trickles down into benefit for the patients as well. So we could talk about it for hours, because the benefits in it, like the sky is the limit of how much you can achieve with AI.
That's amazing, especially in this ecosystem that's fairly complicated with lots of different players that are very important. You just described a rising tide that basically helps all of those different players and constituents. One of the things in my background, so robotics for drug discovery now 20 plus years ago, putting a robot in a research lab, overwhelmingly the first fear, the first concern was that the robot was going to replace somebody. And I've seen this over overwhelmingly with a lot of the hype with AI today, a lot of the initial fear is like AI is going to take all of our jobs. How do you think of AI in relation to doctors and nurses, the future of doctors and nurses? I think you touched on it already, but I'd love to just hit that.
Yeah, well, it's very interesting because when you think about it, it's beyond doctors or nurses. It's the whole concept of, when you look at the current laws or legislation about the safety and ethics of AI, one of the components is assurance that we maintain the human autonomy. And I think the European Union, for example, when they have developed these rules and regulations around AI, they're very, very key on that concept. So we have to remember that the AI primary function is augment human intelligence and support humans and be a tool for the humans. And if you pair that with the fact that the best of the both worlds is when you combine AI plus human in the loop, that in reality means that you are not really going to substitute a human, you are going to evolve a human. So that means that that's why education is important, because when the brain of a human works very simply, when we don't understand something, we fear it. So that fear comes from lack of understanding. That's the first reason why education is important. But the other component of education is how you upskill the human to be able to really use AI in their benefit, and that's important. I will tell you one thing: there's not enough physicians, not enough nurses today to take care of the growing population, not only on aging, but also on incidence of disease processes. That's part of the reason why the system is broken, because you have to see 1,000 people in 2 minutes. So if you're able to utilize tools that allows you to get the history from the patient, so you don't spend 1 hour getting the history, and then just zoom in on the elements that may be important, that alone, will help the humans. If you can have a robot that dispense the medications, but the nurses are going to be the ones that truly can care for the patients when the patients are having to be checked for whatever reason, they get acute changes, and then you have a nurse next to the patient. So it's not that they are going to substitute. I truly believe that AI, well implemented and well utilized, will make the function of a physician more like a function of a physician, the function of a nurse more like a function of a nurse, where the satisfaction for job will be higher, the safety and the quality of care will be better and higher, and the patient will be happier. Mhm. So I'm not worried about that.
No, that's beautiful. And what I just heard is that the implementation of AI and technology actually lets the humans do the more human aspects of those jobs, right? You said 60% of time goes to like clerical, administrative like stuff. That, of course, that's why doctors burn out. That's extraordinary, right? So I can imagine that field could have this amazing flourishing of talent and new breakthroughs when you spend all of your time doing that kind of real work. So super,
I'll
super
give you an
exciting.
example. If I may
Yeah.
interrupt you, I'll give you an example. Everybody now has heard of ambient listening. We have ambient listening at home with our, as Alexa, and you can just tell something Alexa and they play a music for you. But you have ambient listening that you can apply in the clinics, which means that while you're interviewing the patient, that you are actually talking in a natural conversation rather than be looking at a computer writing and then occasionally seeing the patient like this. You can actually engage with eye contact and leaning forward, sitting down with them, not only improves the quality of that relationship, but also the attention of the physician to the patient. There's so much you can just learn by seeing and looking to the patient that you don't get to learn when you're looking at a computer. So imagine the ambient listening, being able to formulate and create a note just based on the summarization of the conversation you have. And then instead of me having to write a note for 30 minutes after I see the patient, I can just read it, correct it, click it, and go. So that's happening already today. That's one of the uses of AI in healthcare. And who can ever say that that's not good? That's extraordinary. But the problem, we probably will need to talk about what are the roadblocks, is the how to implement that, the cost of these tools, and how can you actually select which tools are the best to what you need.
That's beautiful. Well said, in that one of the most important human skills, especially for doctors and nurses, is that empathy that you bring, right? From that deep listening that you're able to do. The other benefit for the patient side is going to the doctor is so scary that if all you're doing is staring at your computer or clipboard, you're not reassuring me with that conversation, right? So if you can actually make that real connection and spend that time with the connection, gosh, so it becomes a much better experience overall for everyone. That's incredible.
Yeah, I have to say that the AI is getting very good about conversing with tremendous empathy. So there are lots of studies that showed, and imagine a physician answering emails. I had 30 emails, half an hour to see emails, plus then finish my notes. Well, I'm going to look at the emails. The patient's going to say, I have diarrhea because I went to Mexico, and can you prescribe something for me? I'm going to go in and say, okay, here, send your prescription for this and that, go to the pharmacy. AI has the time in the world to say, oh, I'm so sorry that you went to Mexico and you end up with this problem. I hope that the rest of your trip was good. Don't worry, we have it all controlled. I send you this prescription to your pharmacy. I don't have the time to write that, but AI has the time. So the patient is going to read that and say, wow, how nice of a doctor that is having that empathy and interested of how my time was in Mexico. So that's something that I can actually not only augment the intelligence of the doctors, but also improve the image of the doctors when discussing with patients. Yeah? There was a patient that kept on the phone talking with a front liner in the office staff, trying to get an appointment. Well, it was an AI tool that was discussing with her and adjusting to her schedule when to get an appointment. Apparently, this patient was super happy with this AI agent, let's say called Elisa. And when it came to the office, was bringing a box of chocolates for Eliza, who was so kind and nice on the phone. And it was an AI agent. So AI agents are really getting very good into demonstrating some of the human aspects in empathy and understanding and connection.
And potentially more consistently too, right? That's the other thing, is like we're very emotional beings, and sometimes I can do it well and other times I can't. So I love that. However, very personal question. You don't have to answer if you don't want to. How does it make you feel when the AI is being very like emotionally engaging? I personally, it makes me feel a little creepy. Like I'm curious, is there, because it's just a language system, right? It doesn't feel those emotions, but it's very, very good at using them. Do you have any relationship with that ability? Does that strike you differently?
And so I have like three answers to that, right? First of all, there is the right to know. I think patients need to know that they're talking to an AI agent. So in that scenario, the emotion that triggers may be different. Just satisfaction with the quality of the process, maybe the only thing you get. The second thing is that, I have an AI tool. I don't know if you have ever used it. It's Pi. It's not it's a base more than just a large language process. It's a inflection point, I think, is the system that creates it. But it's intended to be very conversational with humans. I talk to Pi like I was talking to a friend. You know, I forgot it's a human, and it's not a human anymore, right? I know it's not a human, but to me, it provides a safe sense of satisfaction at an emotional level. But then the third component is as a witness of an AI that may be better than me, providing that empathy. And then that's where, as a person who have envisioned, then it strikes me to be better. So it makes me want to mimic the AI and ensure that I beat the AI in the quality of the empathy that I provide. So, and that's going to be an individual answer. Mm-hmm.
That is amazing, and I am very excited to see how those conversations continue with AI. And already the vision that you've laid out for the future of AI in the healthcare space, interactions with patients and doctors is I'm fully enrolled and very excited about that. So thank you.
We have already talked about the promise of AI in healthcare. Now, what are some of the challenges? Top of mind things like data privacy and security, AI tools and AI agents that aren't governed by HIPAA or ethics, the bias that can creep into training, and regulatory compliance are just a few. Let's talk more about the challenges faced by professionals using AI in healthcare.
Well, Dr. Bowling, in the past, we've talked a lot about the exciting future of AI, the amazing opportunities, but you've also touched on some real interesting challenges with one, the environment. It's moving fast and no one really has the right answer yet. And so there's a lot of different things happening, right? So that's one area. And then I wanted to sort of jump into this concept of trust, right? This is a new technology. Should we be trusting AI? Is that the biggest challenge you think we have? How would you think about the challenges that we're facing today with AI?
Well, thank you for that question because I think it's the key of success for AIs. And as it is for anything in life, humans move based on trust. You either trust something or not trust something. And trust is based on the T on the trust comes from transparency. And AI has a double meaning. The transparency, it has to be the understanding of how the results or the answers of the outcomes that we get from that AI tool, how does it get to it? How do we understand? How can we believe is right and is correct, right? For example, if I have a AI program that is looking at the CT scans of chest of patients, and I am using it to determine when a nodule in the lung is malignant versus a nodule in the lung is benign. And then the AI tells me this nodule is benign. How do I trust that that result is correct? And reality is, and this is the funny part, is that AI is not really working differently than humans to some extent. A physician is going to be looking at the same images, one image after another one, and is going to recognize patterns and is going to determine their opinion based on their training and the understanding of patterns. AI is going deeper than the patterns that we can understand and is able to see differences that the human cannot see. Therefore, the result is probably more accurate as it is indeed, but then we don't trust AI because we don't understand it. So having transparency on how the AI tools are being built and what kind of data they are being built upon, what's the quality of the data. In healthcare, the concept of the bias of the data as a potential bias outcome of the tool, that's going to be incredibly important. So that's where trust and then reliability, that's kind of come together, understanding the process of build up and building tools that are no longer black boxes, but rather, glass boxes is what we need to aim for. And not only then the reliability, but also are we having an accountability of those tools? That's another element of trust. Do we believe that we talked about the accountability on avoiding bias, but also about accountability on the data privacy and the data safety, because we need data in order to build up tools and systems in AI. So understanding who owns the data, is the patient able to opt out of AI? So that's a right that is actually embedded in some of the legislations, even in the United States and in Europe. So all that is part of understanding the need for that to get AI to be trusted. And then understanding that it's legislation that protects AI, which is important because in a way, AI is being currently implemented with very little laws or regulations. Because it's so new, the laws are lagging behind. The benefit of that is that AI is floating without rules. The bad part of it is that it limits the fear of implemented tools that later on are not going to be able to be utilized because we no longer meet the standards of the law or the legislation, and the regulations that will be built up in the future will limit your utilization of AI that you are implementing right now. So all that is part of that, those roadblocks and fear in healthcare particularly. So that's where the development of governance systems, not only governance about data, but governance about ethics of the utilization, the implementation, the growth of AI is very, very important. And within that governance is where you also utilize the governance to ensure that there is an upskilling of the individuals that are going to be part of the AI. And that's where education, the regulation around education is crucial and should be in that component of the governance that is not only at a legislation level in the government level or at the state level, but also at the institutional level. So the solution for all that is education, in my opinion.
Education is definitely has to be baseline, and especially in this environment right now, I think that's probably the only thing that we really can prioritize. I just wanted to sort of touch on a little bit of what you kicked off there with governance and regulation. Very just recently, the Trump administration has passed an executive order called the AI Action Plan, right? Winning the race, and it's very forward thinking in really trying to get us to those potential outcomes that you've described in the past about how amazing productivity, personalized care, all these things that AI can bring. Let's get there as soon as possible, right? So it's this action is actually continuing to free up more work for AI. It's not constraining it yet, right? So what do you think organizations need to be doing, specifically in healthcare, to operate with trust in this environment? And maybe we'll get into education, but maybe can you talk about principles or guidelines? How do organizations implement AI right now in this sort of very sort of free-for-all environment?
The basic principles, the good news is that basic principles are not much different to what in healthcare we've been accustomed to in regards to the privacy of your information. So data privacy and data safety is something that is always been around healthcare, more so than in any other industry for that matter, right? I think for us, one of the most important thing is around the quality of the data too, and the understanding of the of avoiding bias with the AI, because there has already been some big samples of where the utilization of AI led to increasing the bias and the quality of care based on like the basic determinants of health, social determinants of health. And that is something that we need to be careful of as we implement AI, make sure that that's not happening. So as long as you follow the data safety, the privacy policies, the assurance that there's no bias, and then you ensure also that component about human autonomy, allowing for individuals to upscale into AI. I think that that's the very basics, in my opinion, that one needs to follow when implementing
Great. So
AI.
there's strong precedents and background for how we usher in new technologies in healthcare. This is no different, though it may be moving a bit faster, and there are particular things that we have to watch out for with this technology, like biases and other things. So that's very reassuring. I love that. Let's talk about education. What should we be doing as individuals, as organizations around getting involved more, exploring, experimenting with AI?
In the perfect world, I would like for institutions to actually be the ones providing the education to the workers of that institution. Unfortunately, institutions, particularly in healthcare, they have very little budgets to move with. And so that's where, how to educate, for example, 7,000 individuals that work in an average hospital system is a big question mark. But ideally, you want to select an educational programs that start from the very basics and then scale accordingly. And they are adapted to the different positions of that ecosystem. So individuals are assigned educations based on what they do, right? And then they have the option, besides the, let's say, obligatory education, to branch off other areas of education that are beyond what they do, just for the self fulfillment or enrichment of and the ability to grow and move up on a scale of responsibility and so forth. So I think that would be beautiful. In the lack of existence of a structured education in a hospital, in a system itself, and we talk about hospitals, but it could be under any field for that matter, any industry. Then, as an individual, ideally, I like to see a scenario where I can do the same thing, but in outside of the system, where I can have access to educational programs that gives me a roadmap, or you do this first and you grow doing this the next, and you do the next, and not only, and it has to be efficient with limited redundancies, and that also allows me to grow even at a CV level, so I can prove to the world, hey, I have this education, and it also allows me to reach out to higher levels of responsibility or leadership if possible. So I think that's what I would love to see, and it doesn't exist right now. It's not something that that's why I'm so excited to see iCerts, because it's the most comprehensive, programmatic approach to education around AI that I have seen out there.
Great. And so you're talking about really comprehensive learning paths and upskilling paths for roles, for specific roles that you have, or future roles that you're working towards. That's amazing. How important are the credits, accreditation system? Does this plug into the continual learning in healthcare system already?
Absolutely. I mean, we need to have serious numbers of CMEs every year, and the nurses need CEUs. Everybody needs to prove the fact that they have continued to grow in education. So you have to provide different specialty has different numbers. I do an average, I think, about 50 or 60 a year, and then I had to have over 100 and something after 3 years, just for the different subspecialties that I carry. Every time you get a CME, you have to pay for it, right? And you have limited time to do all these hours of education. So if an AI training program is applying CMEs, so when I take my time to educate myself into something that obviously need to get educated on, I also get CMEs, then it's allowing me to also fulfill a requirement of my own accreditations. So it would be beautiful to have the ability to have AI training tools that allows me to give CMEs and CEUs at the same time.
Great. So there's an incentive already to do continual medical education credits. And so if we had more AI related role-based learning paths that were available for those credits, then it would be much easier for doctors to do. Okay, well, previous conversation, you talked about doing education for the patients. And I think that's a brilliant concept. How would you imagine where they would start? How does that relate to the doctor's education? Are those connected? What's your vision there for patient education?
Well, the difficult part of it is that when you look at patients, you had a huge bandwidth of pre-existing level of education. So the average conversation we have with a patient needs to be, I would tell, at an 8th grade level. So you have a patient that may be a PhD in physics and mathematics, and the next person you see has never finished high school. So you have to have education that may also be selected according to the background training of the person, right? So that's in regards to what's the level of conversation of the education. The second thing is about how to lure patients into being educated. And that's going to be also the hard part. I think that the number one thing would be, could insurance companies provide a cut off on the price or an incentive to get their constituents educated? So if you get this training, then you'll get a cut off on your payment for the next year. And if you continue to grow in the education, if you utilize, for example, my chart, we have my chart to communicate with patients, yet there's less than 60% of patients who use it. What incentive do they have to use it? So if you are able to incentivize the patients to learn about AI and use the AI tools, then that will become then a second nature in the future. But thirdly, you need to think about the big fear that AI and technology is going to increase the gap or disparities of care because it depends on the access to technology that then you can utilize AI. So when thinking about educating patients, that's why you need to also include the government to have also ways to facilitate access to education to the patients and access to technology so AI can be implemented across the board, not only to those who have the money to get there.
Okay, we're back to that holistic approach to educating the entire ecosystem. So from the government to the doctors to the patients, and aligning all the incentives across all of them. I think that's a beautiful vision. And I hope that more people will start talking about that and really implementing education systems and learning paths to that degree. Obviously, we're here on behalf and talking with AI Certs, which, that's a big part of their goal is to educate 1 billion people around AI and sort of the future of these technologies. So I think continue this conversation is going to be amazing. Are there any other obstacles or recommendations that you would like to share today that you think we should talk about?
I think we talked about a lot of things already. So issues regarding trust. We could talk more about governance for sure. We definitely could talk more about legislation. I think that's one of my biggest fears right now is the lack of a clear, singular structure of legislation across the old states. And right now, because of that, a lot of states are taking upon themselves to do independent creation of laws, which is going to be awful because even as we think about telehealth today, implementation of telehealth across different states is limited by the fact that each state has the different laws. So imagine if you apply that to something that is going to cross states through the internet or through that should not be limited by arbitrary lines that we are creating in the world. So that's where I think if there was a way to ensure that the legislation is not at the state level, but more at even globally, that would be ideal. So we talk about global, we keep talking about global because in theory, to tell you the truth, AI has the opportunity and the possibility in the future, I don't know how far from now, the close also the concept of healthcare limited by geographical boundaries, where the healthcare can be provided by anybody to anybody anywhere in the world, yeah, even with different language, because language barriers no longer will exist. So that's where having all this legislation on a local level becomes such a ridiculous, for lack of a better term, roadblock that is completely opposite to what we should be doing or thinking about.
Yeah, that's a great point. A localized system, not only is it going to have less data that it's going to be pulling from, right? So it's not going to have as comprehensive a view of potentially a pandemic, for example, but it's also just going to miss the big opportunity for improving healthcare outcomes overall. I share with you that concern. I think the good news is legislation, regulatory always lags new technology. It always lags, right? And because the legislators and governance bodies, they have to get educated quickly as well. And so I think one takeaway for me here is anything we can do to incentivize and to help promote education for legislatures around AI for healthcare is going to benefit us greatly. And then trying to advocate for a more comprehensive view of regulation away from the state-based approach, because just as you described currently in your organization, like there's no comprehensive education. So you take it upon yourself, and everyone is doing a different system. And so now it's not a very comprehensive view. We're doing it at the state and government level too. So it is definitely time for some clear vision and more comprehensive education for all.
Mhm.
Um,
Yep.
Dr. Bowling, thank you so much. This has been a really wonderful conversation, and you have such a detailed and broad view and vision of how AI can improve and empower us and our systems. Thank you very much for sharing that today.
Well, it's been a phenomenal conversation, very engaging and very definitely futuristic. Dreaming about the future is always fun for me. So thank you very much for allowing me to be here today.
Thank you both for this very valuable and insightful conversation. We covered AI in healthcare today, the future opportunities, the roadblocks to implementing AI, and some ways to overcome those challenges. In conclusion, I will quote from the World Economic Forum paper entitled, "Here are 3 ways AI will change healthcare by 2030. Quote, perhaps most of all, I believe we must keep in mind that AI's most powerful use is to enhance human capabilities, not replace them. The heart of connected care isn't new technology, it's people. The people who need to be cared for and the people who work so tirelessly to deliver it to all of us." End quote. Our role here at AI Search is to help educate and empower those very healthcare workers with tools to make the most of AI applications that are being brought to market to drive efficiency, productivity, effectiveness, and patient experience while lessening the burden staff are facing today. Thank you. Have a great day.